This is so cute.
Alright, you guys. So, my name is Nika, and I'm going to show you guys how to take care of your baby.
Okay.
Alright, so the class shouldn't be longer than 2 hours. And I sent Deiondra a checklist, but basically today we're going to talk about how to swaddle the baby, place the baby in a car seat inside of a carrier, give the baby a bath, postpartum depression, which can be affected by both of you guys.
I keep trying to tell him that.
Yes. C-section recovery for you, warning signs for baby, warning signs for you, and a whole bunch of baby stuff.
Okay.
If I miss anything or if you have any questions along the way,
And like the umbilical cord
yes,
care
and
the cradle
circumcision care.
Okay,
Yep,
cool.
all the things you sent me.
I haven't been in class in like 12 years.
Holding your baby and swaddling. So the most important thing when you're holding a baby, especially a newborn, is to support the neck. These new newborns know how to lift their heads up, but you still need to support the neck when you pick them up. And we'll practice that in a second. We will swaddle the baby today, but a good tidbit is when they start rolling over, you don't need to swaddle them anymore. Because what will happen is they'll roll over in the swaddle and they can't roll back over. And that's dangerous for them.
When is that normally?
Around 3 or 4 months.
Oh, so we're going to be swaddling for a while.
Unless like baby just hates it, then you might
Okay.
stop. And then finally, avoid overheating. So I'm going to show you different type of swaddles, but there's lots on the market, and some of them are like really fuzzy. And if you get the really fuzzy one, the baby might overheat at night. So don't have like a long onesie under them at the same time.
Okay.
Yeah.
So you're saying don't swaddle them and have a onesie on?
They can have a onesie if it's like thin like this. There's some in the market that's like fleece. Like it literally feels like a thick blanket like we would cover in. If you have that, they need to be just in a diaper because they'll get overheated.
Okay.
And you wouldn't even know because they just look so comfortable.
Okay.
Okay. So, this is the basic swaddle. This is the one they have at the hospitals. Literally, this one right here.
Okay.
And so, I'll show you and then we'll practice. And then you said you got some swaddles. It's literally like so many swaddles out there. So, you will put the blanket like this, make a triangle, okay? And then you're gonna put the baby's head, always support the neck.
How you pick them up though, if you was laying right there?
So if the baby's laying like this, grab behind the neck, under the bottom. You can just roll them.
Okay.
Yep. Then you will take the bottom, pull it up, like this.
You gotta take his arm in like that?
And then take this side and just wrap all the way around. And then like a little donut.
So when you wrapping them around though, how you support his neck?
Pick it up.
How you wrap it doing do that?
So you have the blanket like this. Usually they're laying down, so the neck it's not gonna like come up like that. So you're literally just wrapping around. The weight of the baby is keeping baby under. So you can lift the bottom of the baby up and it's okay.
Bet. So that's the better way? Okay.
Anytime you swaddle baby, the baby's gonna be laying down.
Okay.
You want to try it?
Yes. So pick your baby up first. Just pick.
Let me pick the baby.
Baby queen.
It's my first time playing with dolls. FYI. So how do I know I grab the neck, but I grab them under the...
Just try it. Just get a feel of it first.
I just feel like a real kid.
See?
Why?
Now put baby closer to you, like on your chest.
Like how?
Like just hold baby closer.
What about the arm, no matter?
No. It's okay. This is your time to kind of get all that out. Yeah. And so then show me how you would put baby on your chest.
I can't do it
That's
like
your
this.
kid.
Just like that. You do it that way or the other way.
Yeah, this the only way I know.
Okay.
But then, wait, like when he like this though, like you see how he on my right here, you can't breathe like that.
Exactly. So when you have baby in any kind of position, you want to make sure that their head is to the side and not directly, especially you when you're breastfeeding. Make sure baby's head is not just in your chest.
And you gotta
have to
hold
breathe.
it. Yeah, like that.
So it's okay. Yeah, bring the baby to. It's your baby.
But I'm saying, you see how I'm trying to like, so this would be perfect because he can breathe now.
But they like skin to skin, so put his chest on you.
Just put him up a little bit. Yeah.
But I'm trying to make sure the nigga can breathe.
He can breathe.
Oh.
His head's turned to the side.
Okay. So I just gotta keep on
Just keep doing. Shake it off. Do the other side.
Oh my god.
Now
Right.
put baby down.
Okay. So you want me to fold?
Here, I'll hold baby while you fix that part.
I'm gonna really be on some shit like.
The first
told
time
you
it's
gotta
weird
do
because
skin
they're
to
so
skin.
tiny.
Oh yeah, I like this already.
Perfect.
And then
Get one side.
it don't matter what side.
Nope, it don't matter.
And then it need to be extra tight.
Mm-hmm. Because what happens if it's loose, baby will start wiggling out.
So,
Put one arm
and
One
then-
on
arm.
top.
Oh,
Yeah.
put one on top.
Yep. So under, yeah. And make sure that side, tuck it under baby's booty.
And you said once I got his arm under there, I can let it go.
Mm-hmm. But make sure this part is tucked under the booty right here. You see how this is just extra out here?
So I need to hold his arm while I take it.
You don't have to.
Okay. I'm just.
If
trying
it
to
helps
be-
hold on to baby, you can. But yeah,
I'm just trying to be all the way 100.
you're doing good. That's perfect. So now you grab the bottom.
Grab the bottom.
Mm-hmm.
This. Oh,
Yep.
flip it up.
Yep, flip it up. And
Like
tuck
arm?
it. Pull it tight.
Good job.
And then where do I tuck this in?
So that just goes under baby. Their weight kind of holds them in. Yep, just like that. And so then now pick up baby in the swaddle. Perfect. That's your baby.
Good job, babe.
All right, your turn.
Okay.
I got it. Hey, you need to catch up.
Yeah.
For real, I ain't even.
Okay.
You know,
I'ma
this
do
time
mine
tomorrow
this way.
I'll be swaddling.
I said your life's gonna change tomorrow.
So tomorrow I'll be swaddling.
Yeah. So the way C-sections,
Well-
we'll talk about it,
But I'm
but
saying, you see how I'm holding him now? This the way?
yeah,
Just
yeah.
Just make sure his neck don't be like.
Mm-hmm.
so just hold his neck up
Yep, just like
like this.
Mhm.
So hold his neck up.
Yep. So the head will probably be just the same size. You'll be holding the head and the neck, literally just like that. Just how you're doing it.
Holding it up.
Mm-hmm.
So like I feel like I'm actually holding it up.
You don't just hold it.
Yeah, you know what I'm
Yeah.
saying? So
Mhm.
just hold so I don't actually
Put too
push
much
it
pressure
up.
on it. Yeah.
Yeah, because I was actually.
It'll
see,
be heavier than that.
You see how
baby
now
said.
I'm pushing it up?
Mhm.
You don't want to push
do
it
that.
up. So like right here.
Yep.
Just hold.
Just literally just pick it up.
Okay.
All right.
So question real quick.
Mhm.
So if I'm trying to like, if I got him like this, right?
Yeah.
Then I want to just pick him up. I just.
Yep. Just keep getting used to it.
I feel like we're gonna be so gentle.
For the beginning.
I
They're
know.
gonna start slinging his ass.
So this baby weighs about 1 pound. Your baby's gonna be a
Oh,
little heavier than
dang.
that.
Oh, yeah.
Yeah.
Okay.
The hand.
Hey, can you let me do this?
Good job.
This one.
Mm-hmm.
Is so? How do you know how tight to make it?
That's what I was about to say.
I don't
So
think
you're
mine
doing
is
good,
tight.
but you are very gentle.
Yeah, mine's not
Your baby's
tight.
gonna wiggle right out of this.
Okay.
So you want it nice and snug. So it's okay. Like, don't feel like you're constricting your baby. They like it. It makes them feel like they're being held. So you're gonna put a little more force into it. So
Oh,
real
okay.
tight and tuck
So
under.
real
But you see
tight.
how that is. So if baby shifts around, they can't,
Can't get
out.
out.
Of that.
Okay.
Put that. Yep.
Already.
We are only on the first slide.
It's fun.
And then right on under. Good job. Now pick your baby up in the swaddle.
I feel like mine looser than yours. You gonna be on swaddle duty.
That's all good. That's funny.
Yeah, I'm over here like, wait, how do I?
See,
And then
that's
you can
what
turn
you
the
got.
head. You can. So the first time you touch their hair, you're like, oh my God, am I hurting him? You literally can just move it.
So boom, you see how? Okay, so you see how? So it's good now.
Mm-hmm.
So what if it go like this?
You turn it. So they'll start nuzzling and things like that. As long as the nose is able to breathe, they're okay. By day 4, you'll have 2 to 3 wet diapers a day. After that, you should have about 6 wet diapers a day.
See, at least one wet diaper, 24. One wet diaper, 24 hours.
Mm-hmm. The first day they're born.
So they only gonna use it once.
Yeah, their stomach is this small. And the only thing that's going to be coming out of mom is colostrum, which is like rich drops of milk. And so they're only going to pee 1 time. After the first day, up to the 4th day, they pee 2 to 3 times a day. And then after that, for the rest of their life while they're peeing, it's about 6 times a day.
Okay.
When you do diaper care, you wipe from the front to the back. you make sure you get into the folds of baby, okay?
Like
in the inner thigh.
Oh, okay, okay.
Keep your hands on the baby at all times when you're changing them on the changing station because they wiggle. You don't want them to fall. And then never leave them unattended. So make sure your diapers, your wipes, or everything is right by baby. You don't want to have to walk away because that could be the day they decide they wanted to roll over. Okay? For boys, we're going to practice. Make sure you always have a wipe or a diaper covering the penis because if you don't, you will have a surprise.
Oh, I got little TPs.
Okay. That works.
Because as soon as the air hit it, they just go crazy.
Yes.
You gonna
Yep. It is like an initiation for boy parents. You will get peed on at least once.
You think so?
You will.
Yeah.
I'm gonna just take it out and get out the way.
It's gonna get you. All right, and then for breastfed babies, their poop is really liquidy and seedy. Okay, sometimes it smells like syrup, and then they should have 3 to 4 poops a day after the 4th day. Okay,
After the 4th day he's alive, he should have 4. He should poop 4 times a day.
at least 4 times. Yeah.
And if he don't, then what?
So we'll talk about that. But that's a warning sign. If they don't poop in 48 hours, then you need to go to the pediatrician.
He gonna poop.
All right, so now we practice.
Yes.
The dirty diaper, let's start with dirty diaper. So dirty diaper's on, right? This is our new diaper. What you can do is you got your wipe, pull this off, have the new diaper kind of guarding. And then wipe front to back, make sure you get into the folds, lift baby up, pull that dirty diaper out, okay? You can either use a wipe or a new diaper to do that part.
So you keep the dirty diaper on while you clean it?
At the bottom, yeah.
Okay.
Because what if it's poop? So you might want to wipe, get that wipe, shove it down
Put it in
there.
the diaper.
Put it in the diaper, then pull it aside.
But you gotta get under his butt too
You don't use more than one wipe.
though. Okay.
Yeah. So dirty diaper under. We can use a wipe to hold, protect, wipe, wipe, wipe. Push the dirty diaper, the wipe in, grab, get your new diaper.
So that's not gonna fuck his back up?
We're not doing all this.
Okay.
Yeah, this is a doll, so it's gonna do that.
Okay.
But that's why they said don't lift the legs because people have been pulling it.
I feel like some people lift the legs because they're cleaning the booty
Mm-hmm.
and they lift it too high.
Too high, exactly. So when you clean the booty, it's the same thing. You get a new wipe, push it aside. Now you got a new diaper. Okay.
How tight do you make that? That part I'd be wondering.
So you want it when you put it on. You want to get it to where
Wherever that's at?
Mhm.
Okay.
Where it is.
So for every diaper, there's always some kind of like little line, and you'll get it all the way to there. Now, when they're first born, you'll find that it's all the way over here. And you can kind of tell how tight it is when you're looking at baby.
Okay.
And there's sizes. So the sizes on the diaper box are for the weight of the baby, not the months of the baby.
Okay.
So when you see size 1, look at the size of it
Okay.
versus like not 1 month. Okay?
Okay.
Because your baby may be out of that size and you're a size 2 even though your baby's 1 month old.
Like,
Yeah,
don't
we can
recommend
do
it because I ain't gonna lie. From back in the day, of course, we always know like change it like this. So this the dirty one?
Yeah.
Okay. So let me see how to.
So you want to learn how to roll over too?
I need to learn everything. I mean, but I ain't gonna lie. If this the method, so boom, it's dirty, right? This the one. Okay.
Remember you got the TP.
Or the TP,
As soon as you
whichever
open
one.
it, put the
Y'all are
TP on it.
As soon
fancy.
as I open it, put the TP on it.
Yeah.
Like on this thing.
Yeah.
So like boom.
Yeah.
Yes.
Yeah. He said lift his legs, right?
Mm-hmm.
You wipe. You gotta wipe the.
Did you write different? Okay, see.
Oh wait, so boom. So wipe the front first.
Mm-hmm.
Get all under his little.
Now, sometimes if they pooped, you may not be able to use the TP because it might have poop
Oh,
right
yeah,
there.
on it, yeah,
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 so in
okay.
that case,
You just use a wipe.
yeah.
Okay.
So this high enough? Or is that too high?
That's fine.
'Cause
Just
I'm
try
trying to
not to get their hips off the table or the wherever the changing station. So just grab
slide my
that.
boy out.
Mm-hmm.
Get a new one.
Yep.
Well, I can still wipe him while you butt naked, right?
Yeah.
Okay.
And let's see the diaper, y'all.
That's the easy way. Alright, what's up, man?
And y'all can changing diapers and bath
So-
time is a good time to talk.
So
to
question, when I'm putting them when I'm putting the diaper on though, I know you said don't lift his hips. And then when I'm putting it up, how do I
slide it in there? Yep, just like that.
Get in that way.
And we'll practice the roll.
Wipe him again. Like a little Pete off. We gotta get on the flight with that. Come on. How you? What does it automatically stick?
Yeah.
Yeah.
So I need to have it on top of his leg, right? Or, okay. You said when he first born, I need to have it all the way.
Yeah, more than likely, baby's gonna be really tiny, so it's gonna go all the way over. And then as baby grow, you'll realize like, okay, this is tight. You need to breathe a little. Yep. So now rolling method.
You know already.
Yeah.
I know.
So this is the dirty diaper, right? And you can just kind of pull it. Roll baby. This is a lot of coordination though, because baby's gonna be heavier than this.
Okay.
But just roll baby over, get a new wipe, roll baby back.
Okay.
I'm not a fan of that one, but
Yeah, so that don't do shit to his head.
no, they're rollable.
Okay, so
I think he'll be a little heavier. So
Because you're really
Even
just
though the head
focused
is
on
moving down.
rolling, like their side is rolling.
so you just trying to like, so I will grab his stomach like on some lights.
Just like that.
But he ain't tripping if he like his
No.
arm, he can roll on his arm.
Yeah.
Okay. So that was it. I do it quick though.
Yeah. If you need to get to the bag, yeah.
And then if I want to, I can still put them back.
Yep.
right there,
and
then
you can
lift
put a
his leg
diaper, yep, just like that.
up. Okay, but if I didn't want
If
to,
you just need to, just
that
wipe
might
the
be
butt
for,
real quick.
for the blowout.
Yeah.
so then if I want to put a diaper on, I would just
Yep. So you can put the diaper back on that way or just the standard
and I
way.
can just slide them.
Yep.
Okay, yeah, I got it. Yeah, but-
You're so.
I will put my little TP real quick.
Yes. Okay, good.
Then,
Now you can focus on just
Yeah.
wiping.
oh wait.
Yep. So first the front. Yep. Then you can grab the legs. Slight elevation.
I'm the type where I probably use like 4 wipes.
That's what I did.
Okay, I'm like, so that's another wipe.
Good.
That's the dirty one, right?
Yeah.
Oh, there you go.
Then I think do we put like stuff on his booty?
You
Or
can.
not yet?
Now, when you have a boy, you want to make sure the penis is pointed downward, or you're going to be changing diapers a lot because the diaper is going to get wet a lot.
So
Okay.
when you put it on, push it down.
It should automatically be down, but sometimes when you put the diaper on, it may actually push upward. So just make sure it's pointed down.
So how we put it down, we gotta touch.
Yeah, it's your baby.
No, I'm just asking.
Oh yeah.
I don't mind. This is my little nigga. I ain't sure. But
Good.
This is important.
Yes. So when you get your baby circumcised, it takes about 7 to 10 days to heal. Okay. They'll be a little tender, but it shouldn't cause them much pain or really any pain. So you will always gently clean the area. So you can use warm water or just the wipe, but try not to like focus on rubbing that area. Just lightly, the penis.
Okay.
Just lightly wash.
oh, say
Okay.
that again, y'all. My bad.
So circumcision, it takes 7 to 10 days to heal.
Okay.
You don't want to focus on just like rubbing the penis. You just want to use warm water and a wipe. So really just kind of wipe around it. Now if they poop, then you'll try to have to wipe a little bit on it, but just be careful. But by 7 to 10 days, you're good.
So you saying when he get it done, when we change him, don't wipe the head and the penis.
Exactly.
Period.
Yeah.
Then when he pee.
So if he pees, it shouldn't get on there, but you'll just use a wipe, a small wipe gently.
To wipe.
So you don't want to just wipe on the penis, just gently wipe around
Yes.
it.
But what if you have to wipe it?
If you have to wipe it light.
Okay, just
Yeah.
tap.
Yeah.
Like,
It will have a yellow crust. Do not rub that off. It's healing. So it's kind of like if a scab is like.
No, you.
You.
Yeah.
You be picking stuff.
No.
No, you
No.
be picking your
Leave it.
stuff.
Let his shit stay on.
No, you need to remember that because you be trying to pick at it.
And then when you go home, they will give you instructions to use a small little gauze.
This the most important part of his life. You gotta make sure this shit. You gotta make sure this shit.
You need to make sure his wee look right.
Make sure this shit important.
You will be told to have a small piece of gauze and petroleum jelly. You'll put a little bit of petroleum jelly on the gauze, and every time you change the diaper, just place that on top of the penis and then put the diaper on.
Hold on, so after we wipe it, pat it, put some Vaseline on.
on the gauze.
What's the gauze?
You'll get a piece of gauze. So like, I meant to bring some for you guys. I'll show you.
Like cotton balls.
Yeah, well, but not cotton.
You're not cotton balls. You're gauze, but you know.
So we just put that. So I'm sorry, I didn't hear the last part.
Yeah,
okay. So that's a gauze pad.
So
small little square.
once we clean it, then we put the jelly, and then gauze, and then diaper.
Mm-hmm.
Okay, so we make sure the gauze is in between the wee wee and the diaper.
Correct.
Okay.
Because you just don't want so much rubbing on it.
Okay, that
so
makes
the
sense.
gauze goes between. So when we pull it down, put the gauze right there. Then
Put the diaper.
the gauze stick or something.
The best way to prevent a diaper rash is changing your diaper often. Okay? You want to keep the bottom dry. So anytime the baby's wet for a long time, they're at risk for a diaper rash. And a diaper rash literally looks like a rash like up here. Of course, it'll be more melanated than that. But
So that comes from leaving his diaper wet too long. So how do you? So basically to avoid that, you just check his diaper all the time.
Yeah.
Okay.
Now, in the event, because everybody's going to probably experience it once, if you do get a diaper rash, there's lots of things you can use. You just want to use some kind of barrier cream. So you'll wipe baby down normally as you change the diaper and put on a barrier cream. So Aquaphora, Destin, but this is kind of strong. So some people like it, some people don't. But any kind of barrier cream to make sure that when they do get wet, it doesn't keep irritating that spot.
So one of the other.
Mm-hmm.
Okay.
Yeah,
Which one
anything
you
you have.
recommend?
I always like Aquaphora.
Okay.
Yeah.
Can I use that for me too? I feel like I be getting rashes when I wear pads.
Yeah. Yes, you can. So that's diaper rash.
Okay.
Any questions about that? No.
Nah.
Gas for babies. So babies do get gassy. So we'll practice doing some leg exercises for your babies. But when they get gassy, they get fussy. And a lot of times it's based on what you ate. So make sure you're mindful about broccoli, eggs, cheese, any kind of dairy that might upset your stomach could upset baby's stomach while you're breastfeeding.
You mean while
While breastfeeding.
Okay.
Once you stop breastfeeding, then it's okay. But
Okay.
anything you eat, just know baby's eating, basically. So when babies are gassy, a lot of times you just need to move around just like we need to move around, but they need help. So you'll take their knees and push inward, push outward, okay? You just do knee and leg exercises to get that stuff
And then
moving.
just go fart.
Yeah,
Will it be loud?
yeah.
Oh, that's what
But yep, just in and out,
Okay.
okay?
I feel like I'm exercising him.
Yeah,
So do it matter how fast you go?
But you don't want to go that fast.
yeah.
Okay.
So just nice and slow.
Oh, okay.
It's
I'm over
okay,
here. Like, okay.
Nice, like literally like you're exercising.
So
And
how do you know when they're gassy though?
they'll start screaming.
Oh, okay.
Yeah, and then you'll start thinking like, ooh, I did have broccoli today. What was
okay.
it?
So I should
Yeah.
think about stuff
They'll
I
be
eat.
extra
Okay.
fussier than normal.
Because you putting it right into him.
Yeah.
Mm-hmm.
All right, let's hit the gym bit. So this is, I'm just getting around.
Okay, you doing it high? Is that right?
Not too high on the hips.
Oh.
So
I'm like
inward, and then just kind of out.
So just not,
Inward and then out with the knees.
like just a little bit.
Mm-hmm. When you go inward, it's best to kind of go up higher though. That'll get to that stomach.
How far? Like, what's my point?
So the knees bend to like right here.
Oh, so
Yeah.
actually bending.
Mm-hmm.
Okay.
You won't break nothing.
Yeah, I know. So even when I'm going wide, like just.
So when
a
you
little
go wide, it's bending wide.
bit. Okay.
Yeah.
But like this?
Yeah.
Okay. And you said that don't affect.
you're so gentle, and you gotta bend it inward, babe. Yeah.
Yeah. The best one is this one. This in one right here. So if you just constantly just go in and out, that's good too.
Who?
Just getting them moving so they can move that gas.
Poo poo.
You warm in the back.
Mm-hmm. So
He gonna be laughing.
So then once you do legs, you want to pick them up, rub in the back because you're trying to get that gas to move. So a lot of like bouncing, rubbing. You can even rub their tummy like this in circular motions. Just kind of getting it moving
But when you got them in your hand like that, how you do is it?
like this.
Okay.
Yep. So always supporting.
Okay.
You want to hold the feet like that. Yep.
Oh, you look so cute.
And then just kind of rub on the belly a little bit. Okay. Good job.
Good job, babe.
All right, so now it's car seat time. We're about to build your car seat in 1 second, but things to always remember: the harness. If you look right by the armpits, that's called the harness. That always needs to be at that spot.
Okay, always in the middle.
So use the armpits as a marker.
There.
Yep, right there.
Okay.
Always, no matter how big they get, what size they are.
It's always in the middle.
And then the straps, we'll adjust the straps. So the straps will be adjusted as they grow, but they need to be snug at all times.
I never knew how to adjust straps, even on bags.
We'll
So I
go
gotta
through it. Everything you have baby-wise will have a manual that you will sit and stare at for the entire time. So keep all the manuals for everything and put them in a Ziploc bag.
Bet.
Because as they grow, things need to be adjusted. Yep. Ready, set, go. That's the car seat case. So this will go in the car. I do suggest that if you guys are traveling with multiple cars with the baby to have another base. So
We have a bunch of car seats.
Okay, cool. So that way you won't have to worry about taking the base out and the car seat
But
out.
you can order more bases though.
You should be.
Okay.
I don't know about the Deiondra, you should be able to.
Okay.
And now you gotta put baby in the car seat.
Move, Wilford.
Yeah, cause so if the strap's in the way at first, that's cool.
Usually they have a little thing to move the straps, but y'all car seat fancy, you don't know how to do that. So what you would want to do is to make the straps bigger first. So use that button. You can put baby down first, in here. Put baby in
Oh,
here.
baby,
Or
wait,
yeah.
Boy, come by myself.
You're by yourself, place
Okay,
baby
my bad,
in.
my bad.
And pull the straps. So press that button and pull one of the straps.
Are these the straps?
Yep. Yep. Good.
This is gonna be the task.
But it's not a task really, because once you get it adjusted the first time,
Oh,
that
it'll be
is
the
easy,
same.
yeah.
Yeah.
All right. So you want to make sure.
Remember what she said.
And then this padding goes over the shoulders too.
If I gotta touch his face, I got to. You can move your face. So where is the?
Remember that go over the chest.
And we on the way to the grammar school.
All right.
Tight.
Nope, nope, nope. You got one more part. Right here. So there's more to the straps. Right here. And then one on the other side.
This is one on top of his leg.
Buckle it in. Right here. Yeah.
If it busts down on him like that, that's cool. A little pressure on him.
Yep. You can adjust that too as baby gets bigger, but right now it's gonna be fine for
For sure,
baby.
because
Easy. Yeah, that's fine. Now you tighten it. And you can actually pull this up, so make sure it's up on chest and pull some more to tighten it. And always just kind of check to see how loose is it. So this is loose, right? So you pull that more.
that's loose.
Yeah. Keep going.
That's loose.
So this right here loose. And then only 2 fingers should be able to fit, but it shouldn't be tight. Shouldn't be too tight or too loose.
I feel cool.
Okay?
Wait, what about this guy?
This, let me see how yours is.
Yeah, I would have said they was straight. Right now, he good.
Yeah, he's good now.
Yeah, you got it.
Good job. Your turn.
I think I. Wait. I don't. This looks like it's twisted.
You got it. You fixed it.
Okay. Wait, do these go inside or outside? Inside like this?
Yeah. Like
Okay.
that. Yep. You want this part on there.
Oh, this is getting twisted in here. Okay, here we go. I feel like I'm gonna break so many nails doing this.
Do not have long nails for the beginning.
I know.
I don't know how people do it with long nails.
Yeah.
Keep
Get them tight.
Keep tight.
Keep going. Alright, check it. Alright. That looks
Oh yeah,
good.
he in
Yep.
there good.
Yep. And so say this is too tight, you want to loosen it. How would you do that? Good job. Alright. You guys did it. Alright, so next is a fun. Do not have them front facing like that over on the left until they're able to sit and their neck is above the top of the carrier.
Okay.
Now some babies are pretty advanced and they move around, so about 6 months or something. If you feel like you want them front facing, we'll practice rolling up a swaddle, putting it under their bottom so they're a little higher in the swaddle, and that way their neck is above. And then finally, with the swaddle, you see all these straps. Once you get adjusted to parenthood, you're gonna be like, oh, I could just put this on and not strap up everything. Don't do that, because it could be one day you might lean over to grab a dish or something, you didn't strap it, and baby falls out. So every time, strap every piece up. So let's practice. So this is a baby carrier. This is one of the good ones. What was I about to say? There's a lot on the market, so I don't know which one you have already, if you have one. But you always want to make sure you have one that doesn't just break your back.
Okay.
So there's adjustments for these as well. There's instructions. It's already set for what we need. But you'll put it on your waist.
We had a few extra. I don't think we have that one though. That one looks like a really good one.
This is Ergo Baby. Alright, so you'll make sure you have it on your waist. You'll adjust it to your size accordingly. Then you'll put one strap in. You'll grab baby. Slide baby in. So put baby on your chest like this. And then you'll get a leg. Make sure it's out. Get the other leg. Make sure it's out. Then put this over baby. Then you'll slide your arm in. And baby
That's
really
probably
should
good for. Can the baby be in there and like with just diaper on?
Mm-hmm.
Oh, so that's
Yep,
good for
So you turn
skin
it
to
to the back?
skin.
Yep.
Let me see. Okay.
So then there's a strap in the back. So this is what I'm talking about. Make sure you strap everything.
Okay.
This one holds it in. So baby can't slide when you start moving. So if I move like this, baby can slide out. So I need to have this locked in.
Okay.
So question.
Mm-hmm.
We can't see baby though.
You look down to see baby?
So he's cool if he hid it in there?
Yep. You're about to practice.
I think that'll be good for skin to skin. Remember I told you that skin to skin is really good.
They sleep very well in this little sack. So put it on your hips first.
Okay. And this one.
Front facing.
So what was the adjustments?
These straps right here will adjust. So we'll pull them.
So once I put it on, I
We'll pull and see.
hold on.
So yours is right here. Yep, grab that. Okay, and so then pull the straps and make it tighter.
Which one? This one?
Both of them. This one right here. Yep. See, you feel it get tighter?
Yeah.
Okay, so put one strap on.
It don't matter which one. Right?
Okay. Then you got your baby.
Baby.
And so you'll just put baby on your chest like normally, right in the middle of your chest. Yep. And then hold on to baby and grab that other strap and put it over. Good.
That's what the leg is.
Mm-hmm. And make sure that leg is out.
Right here.
Yep. It's just that. Right here. Inside. Yep.
Oh, they don't come out. Oh,
Yeah.
okay, they come outside. So it comes on top of it.
Yep.
Okay.
And then you'll put that strap on.
Oh, we do have that one.
You do, yay!
Okay, I'll let
This
you
is my
practice
favorite because
on
it
this
does
one.
not break your back like the other ones.
Okay.
Good. And then there'll be a strap in the
Very
back.
cool.
Says the strap in the back.
At the top.
You look like that video I sent you where you're like on
The
the
strap in.
workout thing with your baby right
Yep.
there.
Oh, yeah.
And then you'll clamp it. So for the men, you usually have to adjust the straps. You guys got two?
We do, but I don't know where the other one is. I thought I brought it.
And we should be straight just because
Yeah.
of my hair.
You'll just have to adjust, yeah. Okay. So that's good, yeah. And there's your baby. Good job.
You look like a daddy for real.
Yeah, I know.
Daddy queen. You're gonna be walking around with the baby on you like that all the time.
All the time. It feels tight though. He alright?
So as he gets older, you'll be able to adjust as well. So see all these straps? They're for reasons. So that'll adjust on the side.
Mm-hmm.
Yep. And then, so say you wanted him, it was time for him to face forward. These buttons right here helps it fold down.
What you mean face forward?
So if he wants, like that picture right there,
When
baby's
he gets
facing
older.
Okay.
So you will make sure this is down.
So how old would I be doing that then?
But it's at the setting it needs to be for a newborn.
What happened if I tell him?
When they turn them around, you don't want the legs abducted so much. So you'll use this next button.
So these good right now? You like it?
When he's facing back, they're good right now. But if he's in the front,
But this one don't feel right. It feel like it's
yeah, because you need to move this in. We're not gonna do it right now.
okay.
Yeah,
So that's not for a few months.
yeah.
Right.
And then you just make sure you strapped in. And that's your front facing baby. But you see how the swaddle push baby up a little more?
Yeah.
So some babies are on the smaller side, so sometimes you just can't help. Yay. How you guys feel?
Good.
Like parents.
Come on, like
Good
parents.
job. All right, let me unstrap. You'll have that in the front, but you're gonna turn baby, hold baby to you, and sit baby in.
Okay.
So turn baby. Yep. Hold baby close because they're movable. Put one leg in. Yep.
What if they head keep turning like this dog?
You just keep turning it. And so when we're at this stage, we always want to
We'll
make sure
undo
that's
that. Yeah. Okay.
Now for your baby, so say we wanted to turn your baby around and they can control their neck, but they're on the smaller side. We'll get a swaddle, kind of roll it up for their booty.
Question, with this, do I roll this back in?
Yeah, I can just stuff that in there.
Or I can just stuff it in?
Mm-hmm. Y'all have one too. So we'll unhook,
And this is to
turn baby around. Put some keys or anything in here, or anything. It's a pocket down there. Yep, a little
You
bag.
can't look though, you just gotta.
You just gotta feel, you'll learn. Then this right here, you have one as well. It's for weather. So whether it's sunny outside or if it's raining, you can cover baby's
Why
head.
strap it to?
There
Oh, right
are,
here. It's
yeah,
a
a
clip.
button.
Like it is a little.
Yep, and you got one right here.
This how I had to go to the airport.
Yeah.
Yep, the germs.
Yeah, y'all know.
So yep, you got the exact same one. So let's practice on yours so you can have your adjustments.
You can't fall on my knees, you can't trip, you gotta watch
Yeah,
yourself.
no, these don't. So like I was telling him, these right here will adjust the straps for your waist.
Okay.
So try to
It look like me for real.
Yeah,
I know. I'm like, I like it.
Yeah, it drip like this. I'm coming like this.
Like
Like,
how we go everywhere.
yeah, I'm coming like this.
Yeah.
You don't utilize that until you
Yeah, they're the one. They're how we coming in. Like,
Oh,
I can show my mom.
Facts.
Well, this bit go over me right now.
oh, here we go. Yeah.
Oh, okay,
So we're
okay.
gonna put it on your hips. Yeah. We won't squeeze too tight. All right. So you'll clip it in like this, and then there's a strap right here. See that? So you'll pull that to adjust the tightness, and there's
Okay.
another strap over here on your right side. You see
What she said?
You see my boy? What's up? You see my boy?
And then, as I was telling him, you're gonna put one
Yeah, I
strap
got him
on
in
first.
here.
One strap on.
Yep. Then you'll grab your babies. I'll give you the CPR baby so you can practice. And this is the butt. And you adjust as baby grows. So we want
Okay.
on this one first.
Y'all see my mama? You did. It's going down. Yeah, I'm getting the hang of it. Look at this.
Here's your baby.
So this one.
So baby's kind of small, right? And so they're not covering, their chin can't cover the top. So you'll put a swaddle in first
Which one is it?
and just have that. So it's kind of like a little base for baby.
So this is for when he's how?
When he can control his neck more.
It's not an age on it.
You'll look at the ergo babies to see if they have an age, but usually it's when they can control their neck better. So I would say about like 5 months, 6 months. Yep.
His arm supposed to stay in this water?
They come out when they're out like this. They usually, yeah.
Oh.
And then what do you do with this part? Yep. Fold it down. Yep.
Oh, babe.
And so when you turn them around with the ergo baby, there's different leg settings.
Babe.
So sweet.
My swag with it. 3 foot. Yeah. Yeah.
All right.
How to get this
Circum.
up?
Oh, so you
Okay.
you got it. Okay. And let's make sure you got
How
it.
long the baby like it real?
We in practice.
Good job, you guys.
I'm gonna have 2 babies.
So turn
How I
around.
tighten this up.
So you tighten.
loose.
So
I feel the
for-
future. This how we finna be. It's 2 of them. I feel it.
So this strap
Look, you
will-
watch what you say, cause you be getting what you say. So.
Yeah, we gonna see it.
right here will tighten baby up.
Oh, okay.
See?
What about the straps? Don't need to be tightened or no?
So those would be. Sorry, straps.
Is it okay?
Forward, girl. You can. I think it right now is just because you got another baby you got going on.
Oh yeah, you right.
Their head and stuff like that, then you can turn them to the front.
Oh, like I turn to the front and take it down.
Mm-hmm.
Okay.
Yep, and he'll just be looking around.
But for the most part, when I pull up on her like this.
Yeah.
Can't be throwing my label like this.
To your meetings.
Yeah. Like it can't yell. Be like, oh,
Go ahead, call the pediatrician, go to urgent care.
Okay.
If you have the baby hasn't peed in 24 hours, go to urgent care. Call the pediatrician. If it smells very foul or if baby has a fever, go to urgent care.
Okay.
Okay? Yeah?
Okay.
Okay.
I know you're gonna be good.
Umbilical cord. So the umbilical cord, as you see up here to the right, that's what it looks like at the hospital. When you go home, they take that clip off. So it's gonna look like that on the left, like this little crusty little thing.
So you said that's how it looks when?
Wait, the
you
one on
come
the
home-
right is what it looked like at the hospital?
Right. So after you deliver baby and baby comes to you for the first time, it looks just like that.
So wait, on the right.
Right
I don't
here.
see nothing.
So hold on. You see this part?
Yeah.
So this is the umbilical cord right here in the middle, this little jelly thing.
Okay.
And they clamp it off with this. So while you're in the hospital, it'll have this little clamp on.
Okay.
When you go home, the clamp comes off and the umbilical cord is real crusty looking like that
Okay.
and shorter.
So then that eventually falls off.
It falls off. So it falls off in about 2 weeks. You don't want to do anything to it. Back in the day, they put alcohol on it, they put witch hazel on it, they put everything on it. Just leave it alone.
Okay.
Yeah, don't touch it. Now, you can do a sponge bath, and a sponge bath is where you are just kind of like spot wash
Oh
it.
yeah, I heard you're not supposed to wash them until it comes off.
Yep.
Okay.
So we don't want a real bath until the umbilical cord falls off, as well as the circumcision heals.
So what about the bath? So I mean, like, what about his butt? If he boo boo, you gotta wash his butt though.
So you can sponge bath. So you would just do small soap and water.
Like a wipe down.
No,
Yeah,
make sure you
basically,
listen to
yes.
us.
I'm listening. But if he boo boo, you still wipe it with a wipe. You don't give the baby
right,
a
it's not
bath
gonna crack.
every time.
Mhm. So your newborn is not outside playing in the dirt, so they don't need baths every day like we do, right? They just need a little sponge bath like once a week kind of thing until they start, moving around and getting active and rolling on the floor. Now, the important part is while they have an umbilical cord, you see how this diaper is folded up downward over here? So your baby's gonna be super tiny, super cute. You wanna fold the diaper down.
Okay.
So we had the diaper like this.
Yeah, we had it over his stomach.
Have the umbilical cord out. Excuse me.
Okay.
So we want it out for how long?
Until it falls off.
Then we cover.
Okay. Yep. Once
When it
it's
falls
done-
off, do we put anything in there?
No, you don't need to. No.
Okay.
Some babies they don't even have like an anything. It's just like outward kind of.
Oh, because it depends if you have an innie or outie. See, I have an innie. Well, now I have an outie. Yeah. Mine was.
The best way to prevent a diaper rash is changing your diaper often. Okay? You want to keep the bottom dry. So anytime the baby's wet for a long time, they're at risk for a diaper rash. And a diaper rash literally looks like a rash like up here. Of course, it'll be more melanated than that. But
So that comes from leaving his diaper wet too long. So how do you, basically to avoid that, you just check his diaper all the time?
Yeah.
Okay.
Now, in the event, because everybody's going to probably experience it once, if you do get a diaper rash, there's lots of things you can use. You just want to use some kind of barrier cream. So you'll wipe baby down normally as you change the diaper and put on a barrier cream. So Aquaphora, Destin, but this is kind of strong. So some people like it, some people don't. But any kind of barrier cream to make sure that when they do get wet, it doesn't keep irritating that spot.
So one or the other. Okay.
Yeah,
Which one
anything
you
you have
recommend?
I always like Aquaphora.
Okay.
Yeah.
Can I use that for me too? I feel like I be getting rashes when I wear pads.
Yeah. Yes, you can. So that's diaper rash.
Okay.
Any questions about that? No.
Nah.
Gas for babies. So babies do get gassy. So we'll practice doing some leg exercises for your babies. But when they get gassy, they get fussy. And a lot of times it's based on what you ate. So make sure you're mindful about broccoli, eggs, cheese, any kind of dairy that might upset your stomach could upset baby's stomach while you're breastfeeding.
You mean, while you're breastfeeding. Okay.
Once you stop breastfeeding, then it's okay. But
Okay.
anything you eat, just know baby's eating, basically. So when babies are gassy, a lot of times you just need to move around just like we need to move around, but they need help. So you'll take their knees and push inward, push outward, okay? You just do knee and leg exercises to get that stuff
And then
moving.
just go fart.
Yeah,
Will it be loud?
yeah.
Oh, that's what
But yep, just in and out,
Okay.
okay?
I feel like I'm exercising him.
Yeah,
So do it matter how fast you go?
But you don't want to go that fast.
yeah.
Okay.
So just nice and slow.
Oh, okay.
It's okay,
I'm already like,
She's like,
okay.
nice, like literally like you're exercising.
So
And
how do you know when they're gassy though?
they'll start screaming.
Oh, okay.
Yeah, and then you'll start thinking like, ooh, I did have broccoli today. What
Oh,
was
okay.
it?
So I should
Yeah.
think about stuff
They'll
I
be
eat.
extra
Okay.
fussier than normal.
Because you putting it right into him.
Yeah.
Mm-hmm.
All right, let's hit the gym then. So this is, I'm just getting around.
Okay, you doing it high? Is that right?
Not too high on the hips.
Oh.
So
I'm like,
inward, and then just kind of out.
So just not,
Inward and then out with the knees.
it's like just a little bit.
Mm-hmm. When you go inward, it's best to kind of go up higher though. That'll get to that stomach.
How far? What's my point?
So the knees bend to like right here.
Oh, so
Yeah.
actually bend them.
Mm-hmm.
Okay.
You won't break nothing.
Yeah, I know. So even when I'm going on wide, like just.
So when
a
you
little
go wide, it's bending wide.
bit. Okay.
Yeah.
But like this?
Yep.
Okay. And you said that don't affect.
you're so gentle. And you gotta bend it inward, babe. Yeah.
Yeah. The best one is this one. this in one right here. So if you just constantly just go in and out, that's good too.
Who?
Just getting them moving so they can move that gas.
Poo poo.
You warm in the back and
So,
He gonna be laughing.
so then once you do legs, you want to pick them up.
this is important.
Yes. So when you get your baby circumcised, it takes about 7 to 10 days to heal. Okay. They'll be a little tender, but it shouldn't cause them much pain or really any pain. So you will always gently clean the area. So you can use warm water or just the wipe, but try not to like focus on rubbing that area. Just lightly, the penis.
Okay.
Just lightly wash.
Oh, say
Okay.
that again, y'all. My bad.
So circumcision, it takes 7 to 10 days to heal.
Okay.
You don't want to focus on just like rubbing the penis. You just want to use warm water and a wipe. So really just kind of wipe around it. Now if they poop, then you'll try to have to wipe a little bit on it, but just be careful. But by 7 to 10 days, you're good.
So you saying when he get it done, when we change him, don't wipe the head and the penis.
Exactly.
Period.
Yeah.
Then when he pee.
So if he pees, it shouldn't get on there, but you'll just use a wipe, a small wipe gently.
To wipe.
So you don't want to just wipe on the penis, just gently wipe around it.
But what if you have to wipe it?
If you have to wipe it light.
Okay, just
Yeah.
tap.
Yeah.
Okay.
It will have a yellow crust. Do not rub that off. It's healing. So it's kind of like if a scab is like.
No, you.
You.
Yeah.
You be picking stuff.
No.
No, you
No.
be picking your
Leave
stuff.
it. Let his shit stay on.
No, you need to remember that because you be trying to pick at it.
And then when you go home, they will give you instructions to use a small little gauze.
This the most important part of his life. You gotta make sure this shit. You gotta
You need to make sure his wee look right.
Make sure this shit important.
You will be told to have a small piece of gauze and petroleum jelly. You'll put a little bit of petroleum jelly on the gauze, and every time you change the diaper, just place that on top of the penis and then put the diaper on.
Hold on, so after we wipe it, pat it, put some Vaseline on.
On the gauze.
What's the gauze?
You'll get a piece of gauze. So like, I meant to bring you some for you guys. I'll show you.
Like cotton balls.
Yeah, well, but not cotton.
You're not cotton balls. Gauze, but you know.
So we just put that. So I'm sorry, I didn't hear the last part.
Yeah,
It's okay. So that's a gauze pad.
So
small little
so
square.
once we clean it, then we put the jelly, and then gauze, and then diaper. Okay, so we make sure the gauze is in between the wee and the diaper.
Correct.
Okay.
Because you just don't want so much rubbing on it.
Okay, that
so
makes
the
sense.
gauze goes between. So when we pull it down, put the gauze right there. Then
Put the diaper.
the gauze stick or something.
It has petroleum jelly on it. Once you're done wiping, you'll place this on top of the penis, and then you'll be able to close the diaper. So you've already put the new diaper on, right? Under the bottom.
Okay.
Right, and so now it's getting ready time to close. You want to take your gauze with your jelly, place it on top of the penis, then close the diaper.
Okay.
So that way when baby's moving around, the penis is not being irritated by
So
this diaper.
thing is, I still point it down and just put that if you point it down, then that means the gauze gonna be right on top of it.
Yeah, it's fine.
But it ain't even getting the head though.
You're going to place it right on there.
So just say like, if this is a little thing, right? Like, and
Point it
then I
down.
point it down.
And place this. It's not going that deep down. So the baby's penis is like...
Not
Now my boy shit got a bit.
Not you thinking it's gonna be tucked under.
It's going to be real noticeable. It grows with time, but... From the beginning, it's going to be real smack dab. Okay?
It's gonna be like this, babe.
I got confidence in my boy. Yeah, real good.
What do they cut? Well, what is he gonna cut the umbilical cord with?
Scissors. So, you, are they letting you do that?
Yeah.
At the, for a C-section? Okay, good. So yeah, what you'll have is a clamp right here. You see that clamp right here? And there'll be these clamps, these little silver clamps that they'll put on the other side, and they'll give him scissors to cut in between.
Oh, okay.
Yep.
And then how does it work when because I'm doing the preserving stem cells of the umbilical cord too. So do they just do that in there too?
Yeah.
Like after he cuts it or before?
After he cuts it.
Oh, okay. They'll just take it and then.
Yep. So they will let him cut it Once you deliver your placenta, that's when they'll take the blood out, cut a piece of the cord, and send it to the lab.
Okay.
All right, bath time. So baths should be about 98.6 degrees to 100 Fahrenheit. I have never given a baby bath at 100.
I'm like, that's hot. That's like a
hot.
jacuzzi.
That is what they say everywhere, but my temp was always like 98.6.
So the water should be hot.
Warm. Yeah.
But 100 might be too hot.
100 is too hot.
I mean, like, just, I know warm, like, just warm.
Mm-hmm.
Okay.
So they have a lot of cute little thermometers out. They have like little shapes.
We have some of those.
Okay, good. And it'll tell you if it's too hot or not.
Okay.
Like we said, sponge bath until the cord comes off and the circumcision is healed. When you give a baby a bath, you want to make sure it's not under a vent or next to a window, anywhere that it can get too cold, because you want it to be toasty in there.
Okay.
You want the room to be hot.
Toasty.
Like, feel good.
Yeah.
Say less.
And then, like I said, they don't need one every day.
Feel good.
Yep. Anything you don't want to get in, don't put your baby.
And then how is it in heat though? Because we're going to be staying in the heat.
If it is heat, just kind of be mindful of like how you feel. So heat wise, as in what?
Hot. Like, I mean, like when you outside with a baby. You saying like, if I'm hot, I know this nigga.
Giving a bath?
No, like if you.
Just in general.
Oh, just
like
in general.
If we're outside.
Okay, yeah. So try not to have baby outside in the heat too much. Make sure that baby's staying hydrated. So while you're breastfeeding, make sure you're offering the breast often.
Okay.
Make sure they don't have like direct contact. So that's why like the carrier has that shade on it.
Okay.
Your stroller set should have like a little shade thing, or you could get one. Just make sure there's no direct heat on baby.
Okay.
Yeah. And if you start seeing signs like heat bumps, so it literally looks like little heat bumps on baby, or baby feels too hot, then you know you need to get baby out.
Yeah.
Okay.
Yeah. And then with bath time, do not leave your baby unattended. It's always, we will always forget something, but try to have everything right there with baby, or baby's just gonna have to miss that item that day. Okay. So let's talk about baths. There are so many baths on the market. Literally can just
Sponge bath, it'll be water in there?
So you can have water in this part, or water in the big tub.
And then you just said sponge bath, so you want to drench it out and just like, really just like.
Yep.
You don't want it to be dripping.
No. When you give a newborn a bath, you always want to make sure you are making sure they're warm. So you want to have some kind of towel over them. You see the baby? A towel over the baby on the parts you're not washing yet, right? So you get the water, wash the face, the neck, behind the ears, and then get the water, start focusing on the front. When it's time to focus on the back, you'll lift baby up slightly like this. Start supporting the neck and the head and getting the back, okay? Yeah. You want to practice?
She must have make sure we watch under the neck. Some babies be staying.
Yes. As they get older, it's a little more difficult because they start moving. They don't want to sit still.
I think my only question was, I seen like when you dripping in the water, you said you don't want the sponge to be dripping. You want it like dry wet.
It can drip water. Just be mindful of those areas, the umbilical cord area and the circumcision, because you want to keep them dry.
I think after that heals, then it could drip on.
Yeah.
But until it heals, then it needs to be.
You want to do just making sure you don't get.
That's why the water need to be a good.
And you don't want to do it in a drafty area.
Come on, you good.
You okay with the
I'm
baths?
waiting for you to tell him.
Oh. We good?
Yes.
Sure.
You think you good, babe?
Yes.
Breast. There are a lot of things on the market now, and this is a breast massager. So you will literally place it on your breast, and it should massage that
Rumbler.
Yeah.
The rumbler. You
I
stupid.
might have a view of these already.
You stupid.
Just put it on your breast.
Okay.
But that would help get the duct unplugged and the milk flowing. Anytime you have any problems putting baby on the breast, it usually helps. But say you can't, right? You would try to do some massage or some heat. So that is a plugged duct. Okay. Next is engorgement. So engorgement is when your breast gets so full of milk and it hurts. It's usually shiny and just discomfort. And the problem that usually causes this is that you just didn't feed baby. So you missed
I was going to try to pump too.
So you probably missed a pump or a feeding baby. And so
Okay.
the milk just got too full and it needs to come out.
Okay.
The best way to relieve that is warm compress or pumping or putting baby on. Now, when you have engorgement, your breasts are really hard. And so if you want to put baby on, you need to put a warm compress on your nipple first to soften it. Because it could be so hard that baby's like, I don't want to latch on this because I can't grab it because it's so hard. So you need to soften it a little bit, then put baby on.
Okay.
Okay? If you do not fix your engorgement, you could have mastitis, which is an infection. That is not fun. You usually have a fever, like you literally don't feel good.
Okay.
You have a fever, your breasts are red, they're hurting, you just don't, you feel like you have the flu.
Okay.
So in that case, you will have to call your OB doctor and they'll send you some antibiotics.
Okay.
And the antibiotics are safe to take while breastfeeding, but you still keep breastfeeding. So try not to get engorged.
Okay.
Also, to prevent mastitis, you want to make sure you wash your hands before you feed often, okay? So always washing your hands, always making sure if you're pumping, the parts are clean, bottles are clean, everything's clean.
Okay.
So you don't give yourself an infection. Speaking of bottles, everybody knows the big brush that you clean the bottles with. The nipples have a small brush that you have to get inside of it, okay? So make sure there's no milk stuck in the nipple of the bottle.
Oh, you meant in my nipple? I was like,
No, of the bottle.
Okay.
So you use a small brush, okay?
Okay.
Most of the big ones have like a smaller one that comes with it, and that's what it's for, to clean the inside of it. And then finally, oversupply or undersupply. So you may have too much milk, which is a blessing. You'll just use that to kind of make a stash. You may have an undersupply, which is okay. It's nothing you did. It's just your body. Things you can do to kind of increase your milk supply: eat lots of oats. So oatmeals, those Nature Valley bars. I have something for you, but it's a tea that'll help you increase your milk supply.
So can I start that today?
Wait till after.
Okay.
And that's 8 times a day. When they first start feeding, around day 3, when you're at the hospital, they do what's called cluster feeding. It's at night, and the baby wants the milk all night. So she's gonna be a little cranky on day 3, probably. Baby's gonna be a little fussy. And they usually go through cluster feeding through growth spurts. So around 3 days, around 6 weeks, around like 3 months, anytime they hit like a mark, they cluster feed.
So baby should eat up to 8 times a day.
Mm-hmm.
Damn, my titty gonna stay out.
Try to feed on each breast, okay?
Yeah.
And then when you are, so say you do want to drink, try to make sure you feed baby before you have a glass of anything, okay? And wait to 2 to 3 hours afterwards before you feed baby after drinking.
Like drinking alcohol or just drinking
Alcohol.
anything?
Alcohol.
Oh.
While you're breastfeeding, you want to make sure you're still taking your vitamins, watch what you're eating, and just kind of eating healthy, because everything you put in, baby gets.
Okay.
Oh yeah, so if you drinking, the baby get that.
Yeah, so that's why you gotta wait a little bit.
Oh yeah.
But I
I'm
mean,
drinking now.
Yeah, when I'm drinking anyway.
oh, okay.
For the 12 months, let's say freshly expressed or pumped up. Never previously frozen. Or you can keep for a year. Okay.
Just make sure you label. So when you label the bags, you want to put the dates that it would expire.
Okay.
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 So like if she squeezed one and froze it, she could put this will expire in a year. She don't touch it.
Yep.
Right.
So each day you should try to do it about 3 to 5 minutes, and that's just letting them be on their tummy, kind of talk to them, see if they can start trying to move. As the months go on, you'll see them trying to scoot and try to roll.
Okay.
And when you have like little toys, with the tummy time toys, it'll help them kind of move more because they're attracted to the toys.
So we start that now at newborn?
You can start it the first week.
So what you mean? Like just put them on his stomach? Like when I'm just chilling right here, I got a cover in the middle of the floor. Like
Yep, but you get down and play with baby at that time too. Because you'll do it for only like 3 to 5 minutes. The first time you bring baby home for like the first week, I'd say probably like 1 or 2 minutes, right? But then the next week, you can up it to like 3 minutes to 5 minutes.
a day.
Once baby is about 2 months, you want at least 30 minutes to 45 minutes of baby being on their tummy.
Cause I see the flat head. I don't want the head to be flat.
Exactly. So this is why we do it, to also make sure the head doesn't get flat.
But he got it on his back of his head though.
Exactly. But that's why we put them on tummy time, so it's not always flat. You see what I'm saying?
Yeah.
Now, some babies are just prone to having a flat head. That's a whole different thing. You'll have to get one of those little helmet
Flat head.
things to help shape it, but not everybody. Okay. And so that's also important because their skull is not formed all the way. So that's how baby's able to come out vaginally, because the skull's actually shaped to come out.
Okay.
But once baby's out, it starts fusing together and it's nice and hard and starts getting harder as you go. Do not rub constantly on the baby's head. If your baby comes out with some molding, leave it alone. Back in the day, the grandmas were like, rub that head, leave that head alone. Okay? And then finally, baby warning signs. So when you bring baby home, make sure you look out for any yellowing of the skin or the eyes. Make sure you monitor any fevers. Make sure they poop every day. If they don't poop in 48 hours, that's a problem. Make sure they pee every day. If they go 12 hours without peeing, that's a problem. Any unusual high-pitched cries, rashes that pop up, or bloody stool or vomit, those are bad. Now you can give baby infant Tylenol for fevers. It's usually recommended after 2 months, but if you get your baby does have a fever, just call the pediatrician and they'll be able to guide you.
Damn, Tylenol already? Hell no.
Well, that's usually the only thing they can take. So you know how we have different options for everything? They literally can only have Tylenol.
You gotta ask them people at the country in Jamaica what they do.
The natural.
On your belly, don't exfoliate until after 6 weeks, okay?
Okay.
Some people get it, some people don't, but what a lot of black women, you do get it, okay? It's just because we have a lot of melanin.
Okay.
You may have some urine changes. You shouldn't, but if you do, you may need pelvic floor therapy. Constipation is more than likely going to be a thing, especially since you'll be on pain medication. They will give you Colace, but you can also take Miralax.
Okay, Miralax is cool.
You will sweat a lot. That just comes with postpartum. Your hormones are changing. Now, another thing with postpartum, since you are breastfeeding, your progesterone levels will be high. So your libido may be low after, okay? I recommend you don't have sex till after 6 weeks anyway, because even though you're not bleeding, like having a cycle, if you're breastfeeding, you actually may not have a cycle for up to a year. So that's great. But you may still ovulate. So you don't know if you get pregnant. Yes. So be careful. So that paper.
That's a good thing. She didn't say nothing wrong. She said you won't breathe and you can have a baby.
And I said your libido will be low while she's breastfeeding. So you will have to initiate things. It's not that she doesn't want to, it's just her hormones are switching.
What you mean? Say that one more time?
So her progesterone levels will be high. So her libido, because she's breastfeeding. So her libido or her sex drive may be low. And that just comes with breastfeeding.
Oh, yeah.
Yeah, so you just, if y'all want to have a good time, you're going to have to work up a little bit. That's all. So, that paper is warning signs. So as you know, preeclampsia is very high in African Americans. So that paper has warning signs to look out for once you have your baby and you're experiencing problems. So we don't want any shortness of breath, high blood pressures, headaches that don't go away, bleeding too much, or swelling, okay? So that's always mindful. If you experience any of those things, say something.
Okay.
Cannot mentally get it together because you're so tired and this is a new schedule for life. So you get irritable and it leads to postpartum depression. It can last for up to a year postpartum. So you may be fine for 6 months and then all of a sudden, the 7th month, you just feel sad and irritable and you don't know what's wrong. It could possibly be postpartum depression. Baby blues is something, mom, that you will have the very first 2 weeks, and it's just all your emotions. So you may just be crying one day and he's like, what's wrong? And you'll be like, I don't know. And you just cry. It's just baby blues. It does not interfere with your daily life. Anxiety, so postpartum anxiety is a thing. And that's when you're constantly worrying, you're constantly stressed and obsessing over things. And it's affecting your life. And so that's actually a thing. Maternal anxiety is normal. So once the baby comes, you may have anxiety naturally. That's going to stick with you for a while. But when it gets to the point where it's interfering with your life, that's postpartum anxiety. Okay? Psychosis, it can happen for up to a year. And that's when you start hallucinating, you're hearing voices, you're having an alternated perception, and you are starting to think of hurting yourself or a baby. At any point during postpartum, it's always good to ask for help. But if you realize that you're starting to feel off, ask for help, okay? Don't think that because you ask for help, someone's going to call the police, they're going to take your baby. We have lots of resources out here where that is not the case at all, okay? And you make sure you pay attention to her moves and stuff so you can kind of detect things, okay? All right, so now it's time to get active again. This is CPR. So you are going to have a baby, you have to keep alive, right? You should get one after, and this is going to be your best friend, okay?
Okay.
So a C-section is major surgery. They're cutting through 7 layers of your skin, okay? So you may get up and be like, I feel great. It's gonna take some time to heal, okay? So even like 8 months down the line, you may be like, ooh, I feel something. And that's just things are healing still, okay? So the binder goes around.
8 months, still healing. Sir.
We'll get through all of it. So she won't milk it. Alright, so the binder will hold everything in because your organs and everything has to go back into place. So as you see her down there, you will have like a small little pudge after, but this will hold everything in. Your first laugh, your first cough will hurt. So make sure in the hospital, put a pillow over that before you think of like laughing. He may make you laugh. Grab a pillow. Yes. Grab a pillow and hold your incision before you laugh or cough, okay? But this is when you go home, when you're walking around, wear it as much as possible.
Okay.
And that helps put her back in place.
So you need 2 weeks of rest where you don't need to do anything except for take care of that baby. I don't want you going up and down stairs. You need to have a caddy where everything's there. So your water, your food, everything in one level. Diapers, wipes, baby, right there, okay? Your incision is going to, it needs to stay dry. So you don't need to take baths, you do showers. The soap and water can run down your incision, but don't apply it directly on it for the first 6 weeks, okay?
6 for the first 6 weeks.
The first week, 1 week after your surgery, you'll go to the doctor and they'll check out your incision just to make sure it's healing the right way. But for the first 6 weeks, just make sure you are showering and don't put no direct soap on that scar, okay? After 6 weeks, you're good to go to like exfoliate and all of that. When you get up, make sure you roll to the side. So don't just get up straight up like this, okay? You want to roll to your side and then get up. And like I said, it takes about 6 weeks for it to heal and for you to feel good, but ultimately about 8 months before you start feeling 100%, like internally. Pain meds, you'll get them while you're there. Because yours is a scheduled C-section, you should have a spinal epidural, so that means it's not going to last in your system that long. So about 3 hours and then it should be out. But you will have pain after because it is surgery. So they'll give you pain medicine there. They'll send you home with some. Try to stay on top of it. So don't say, oh, I'm going to be good. For at least the first 2 weeks, stay on top of your pain medicine and it'll help you heal quicker because you're not in pain. Okay? And then warning signs. Redness on that incision line, if it looks like it's separating, if it's warm to touch, you have a fever, or you see like oozing discharge, you need to call your doctor. Okay.
It's wet right now.
Everything. So just be mindful, just kind of walk around like, ooh, baby can choke on that, baby choke on. You go ahead and pick that up, okay? So, but most of the time it is food. So when a baby chokes, they either choke or they're gagging, right? So you're gonna have to learn to differentiate between the two. Gagging is when they're making sounds still. So they're chewing and you see them making noise and they're working through their food. Give it a second. Yeah, because they're eating too fast probably. So give it some time. If you see their eyes kind of look bigger and they're not making noise anymore, they are choking. Okay? So you get baby.
So it's best to just chop their food all the way down.
Yeah. Yes.
Yeah.
So you'll pick baby up and straddle baby on your arm like this. So you want to hold their face in between and
this
straddle.
is where he's choking.
Put baby on your knee, head down. The head needs to be down because if something comes out, we don't want it to go right back in there. We want it to just come out. You're going to do 5 back slaps first. So take this hard part of your hand and 1, 2, 3, 4, 5. Most of the time it comes out with that.
Hard?
Yeah. So it's okay. Baby's moving and squirming around. So hold them tight and then 3, 4.
Hard like that? That's hard.
Yeah. You want it out.
I'm saying that's hard. Like I'm hitting myself like that. That's how it's supposed to be?
Yes.
This shit hurt me.
You want it to come out. If you just give them a tap, it's not going to come out.
Right. You got to get in there.
So if it doesn't come out like this, you're going to flip baby over. The fingers that we did for compressions, 5 times. So 1, 2, 3, 4, 5. Okay?
So people be putting them on the back with that about.
So that's just back in the day when they did it. Most of the time it works. It's like a back slap. The only thing that's wrong with that though is the head is still up. So you could have gotten it out, but if it doesn't shoot that way, if it goes back down the baby's throat, and you just cause baby choking.
Well, look at your finger.
I'm trying to fix it. Okay. Like, can I ask her a question first? How do I put my hands up here? Just like this?
Yep, and just kind of make sure the head is angled a little more. Yeah,
Okay.
Yep. Yep, and then turn baby over. 5 compressions. 1, 2, 3, 4, 5. So say you did that and you see the item that they were choking on. So say it was a grape. You can grab it and take it out. If you don't see it, don't start searching in there because you may be pushing it down. If you see it and you can't grab it, just turn them over, do another back
Do
slap.
another one and then go back. Okay.
Yep.
So how I do it?
Not like that. So have baby straddle your arm. Yep, just like that. And 5 back slaps. And turn baby over. You don't have to do this one a beat. Now the good thing is when you do have to do this, your adrenaline will kick in. So you're not going to be thinking about how hard am I hitting baby. You're just going to do it.
Yeah, like, bro, come on, man.
Yeah. Yes. Okay. How do y'all feel about that?
Feel good.
Good.
Okay.
I know I'm gonna have more. I ain't worried no more. It's like, come on, man.
And 2.
So 30, then breath.
2 breaths.
So 30, then
Correct.
and then go back.
Yep.
Or wait.
And keep going. So you just keep going. If you're by
Oh,
yourself,
so- okay.
yeah, you'll have to call 911, put 911 on speaker, do your compressions, and 2 breaths. Now, if he's here with you,
Okay.
or if you guys are together, you can say, "Hey, babe, your turn," and then.
Question. So I've never seen this done before. You know, I grew up in the house with kids too. Like, this happens when you said they would choke on something. So you mean like, because usually when a kid choke on something, like, you know, you'll see people pick them up.
Correct. We'll go over choking in a second.
Okay, so
This is if baby becomes unresponsive. So if you have baby crying, and then all of a sudden baby stop crying, you go up to baby, you'll tap the foot, because this foot, they have a startle reflex. So if you touch their foot, it automatically like fans out. Like you can play with it tomorrow and you'll be like, oh, that's so cute. But it's a reflex. So if they don't have anything going on where you tap their foot, you don't feel any breathing, you need to do CPR.
And then you've got to put your mouth on them, right?
You missed that part.
So you'll do 30 compressions, right? Once 30, so 29, 30. I'll put my hand right here and under the chin, pull back. And then blow in 2 times.
Cover their nose too with your mouth.
Right.
The nose.
So
and
hold on,
the-
so boom, I lift his head up, and then what?
And so then your mouth is going to cover their mouth and nose.
Okay,
because their
whole
nose
thing.
is. Yep. And you're going to blow as if you're blowing into the candle. So, yep.
Okay.
And then go back to compressions.
So you just CPR, you just trying to get them to breathe.
You're trying to get the heart to pump to help
Okay.
them breathe. Yeah. Because at this point, the
So
heart has
does
stopped.
this? All right. So this is not gonna happen though, but this just in case.
Yeah.
Yes.
Yeah,
They
this ain't
say if
gonna
you practice enough, it'll never happen.
Yeah, this ain't
The
gonna.
choking, we're going to practice too. That will happen.
Yeah.
We'll use armpits as the baseline like we did with the car seat. You can either do 2 fingers like this, or you can do 2 thumbs. But because baby's small, your thumbs need to overlap. So like that, or push down. So try those 2 methods and kind of see how you feel first.
Just one.
Uh-huh. And the 2 green means you're pushing good.
I said, oh, that's a bad push.
Yep. That feels okay. Try your thumbs. See how that feels.
And we don't. Why do I need to hold them while I'm doing the thumb?
Just like that. Yep. And push. Okay, good.
You do 30 of those.
Yep. So you'll do the beat, staying alive, but you can't sing and count at the same time, but try to get that rhythm. So, stay alive, stay alive, but you're going to count to 30. So, all the way to 30.
I'm staying alive. I think I know how to do more than 30.
That's fine. All right, now you try. See how you feel. And 2.
So 30, then breath.
2 breaths.
So 30, then
Correct.
and then go back.
Yep.
Or wait.
And keep going. So you just keep going if you're by
Oh,
yourself.
so- okay.
Yep. You'll have to call 911, put 911 on speaker, do your compressions, and 2 breaths. Now, if he's here with you,
Okay.
or if you guys are together, you can say, "Hey, babe, your turn. And then
question. So I've never seen this done before. You know, I grew up in a house with kids too. Like, this happens when you said they would choke on something. So you mean like, because usually when a kid choke on something, like, you know, you'll see people pick them up.
correct. We'll go over choking in a second.
Okay, so
This is if baby becomes unresponsive. So if you have baby crying, and then all of a sudden baby stop crying, you go up to baby, you'll tap the foot, because this foot, they have a startle reflex. So if you touch their foot, it automatically like fans out. Like you can play with it tomorrow and you'll be like, oh, that's so cute. But it's a reflex. So if they don't have anything going on where you tap their foot, you don't feel any breathing, you need to do CPR.
And then you've got to put your mouth on them, right?
You missed that part.
So you'll do 30 compressions, right? Once 30, so 29, 30. I'll put my hand right here and under the chin, pull back. And then blow in 2 times.
Cover their nose too with your mouth.
Right.
The nose.
So hold on, so boom, I lift his head up, and then what?
And so then your mouth is going to cover their mouth and nose.
Okay,
because their
whole
nose
thing.
is. Yep. And you're going to blow as if you're blowing into the candle. So, yep.
Okay.
And then go back to compressions.
So you just CPR, you just trying to get them to breathe.
You're trying to get the heart to pump to help them breathe. Yeah, because at this point the
So
heart has
does
stopped.
this? All right, so this not gonna happen though, but this just in case.
Yeah.
Yes.
Yeah,
They
this ain't
say if
gonna
you practice enough, it'll never happen.
Yeah, this ain't
The
gonna.
choking, we're going to practice too. That will happen.
Yeah.
What's the orange?
So that means you're going too fast.
Oh,
So,
okay.
1, 2, 3, 4, 5, 6.
Oh, I see.
seven,
Okay.
Tempo, babe.
You're
Rhythm.
the music one. Okay.
Got it? Okay. And then try the thumbs. Yep.
Oh, the thumbs are easier.
Yeah. So when you do CPR, it could be a possibility where you are by yourself. And
Oh, but I do better on the other one.
Yep.
This one is,
But you may have to keep doing this for a long time. So you might end up
Switch.
switching. Yep. Baby together, especially with your lifestyles, communication is going to be key. Okay. The major problem that new parents have is that they feel like they don't have help. So communicate always with each other, regardless of like your schedule. Make sure one knows the schedule so that they don't feel like they have the baby all the time, you know. And then making sure you have a schedule for yourself as far as sleep. So if he takes on nights, so you can take a nap, or you can have like dedicated sleep time, or you take a time so he can sleep. So just communicate with each other, and then continue to plan dates. Okay, babies take up a lot of time. Still date each other. Okay,
Right.
and that's it.
That's the class.
That's class. Thank you.
That shit was helpful, Shawty. Now you taught me a lot of things I didn't know.
Good.
Thanks. I feel very confident. Very confident. Watch.
glad you do. I learned a lot of things I didn't know either.
Yay. And then you have your folder with all this stuff in it. Now I have something for you. I've got to find it. Here we go. So this is for you.
Thank you.
Welcome.
So I'm complete, right?
You're complete. Class
you so much.
dismissed.
That's how I used to be in school. Soon as that bell rang, like shit.
I had a great time teaching you guys how to get ready for your baby. Congratulations, and I hope you guys learned a lot. My Instagram is midwife.nika, and if you need a birth class out there, you want to get ready for your baby, go ahead and DM me.